Okay, so today we're going to talk about leaky gut, the controversies explained. I can't even believe that at this point in time we have to talk about this. We've had some questions over the past week as to whether it's been, whether it's real. We've had people tell us that they've seen in certain resources that it's not. Oh my God! I mean, I can't even believe this is even still a discussion. But we are going to address that right now. I'm Dr. Martin Rutherford. I am a board-certified functional medicine doctor
and a
chiropractor since 1970.
Certified functional medicine practitioner. Dr. Reno Gates, board-certified chiropractic neurologist, also a chiropractor.
We've been in practice a while now. Dr. Gates has been here for about 6 or 7 years. We've treated about 1 million leaky guts. In that time, I'm exaggerating. Okay. Leaky gut, I can see where at the time it came out, it was controversial. The term we have never embraced in the sense that it leads to things like this. It leads to maybe someone in the medical community say, oh, that leaky gut, it doesn't exist. And then maybe you think, yeah, leaky gut, what a stupid name that is. We prefer the name intestinal permeability, but frankly, even the mountains of literature that may be presented here today refer to it in the science as leaky gut.
Right.
We're going to discuss the internet a little bit. We're maybe going to discuss Wikipedia and how unbelievably accurate it is. Sarcasm, okay. I mean, I wouldn't be using that for your data if this is something that you're looking for or anything, and we'll discuss that too. And I think the reality is it's so stunning that Dr. Gates just informed me of this before we went on to hear it. I'm just shaking my head going, there are people out there who still don't believe that there's leaky gut. This is not a belief, people. This is like the reality of what's going on in your brain. And it's amazing to me that there's anybody out there who doesn't have a leaky gut, because there's so many things that attack the inside lining of your stomach, which is all of 1 cell thick, that it's amazing to even think that that barrier could not be compromised. So why don't we go from there? Let's start with, what do you want to start with? Because that's like what we're going to do.
That was perfect. That was really good. And you forgot to mention that we have 112 articles attached.
I didn't know how many. I thought it was about 130 or 40 from all the things that we had laid out there.
And to be specific, you need to go to powerhealthtalk.com to access these articles. So the same video will be on powerhealthtalk.com. You go to the Hangout tab, then you scroll down and you'll see 112 articles that were selected for this broadcast. And we'll kind of take you through how we chose these articles. Leaky gut syndrome, at this point, it's an irrefutable entity in the literature, but we'll talk about the arguments being posed by some of the critics, and we'll also discuss how they will use terms like credible or hypothesis to really confuse the lay public, because you're sitting out there, you don't know what to believe. You're not a scientist, you're not a clinician, so how are you going to decipher what is what? And hopefully in today's broadcast, we'll be able to illustrate both sides of the argument so you can really understand, in this case, the plethora of evidence in support of leaky gut syndrome, and see how maybe some of the counter arguments, I don't know, maybe some of the weak spots in the counter arguments.
And quite frankly, I mean, we've been doing this for a while. Dr. Gates has been here for 6 years. I would say even as little as 5 years ago, we would hear a lot of static on it from other doctors.
Right.
Okay. And the other doctors would go, oh, those guys, probably same thing that some of our patients that talk to us have heard. Oh, there's no such thing as leaky gut. Well, they haven't heard of it 5 years ago. Okay. Gastroenterologist, intestinalologist, I was going to say. Gastroenterologist, even here locally, and there's a couple of large groups here, and they would make fun of it. Okay, nobody here makes fun of it anymore. We never hear that. We never have neurologists or gastroenterologists or endocrinologists or GPs saying, well, those guys are crazy now. There's the leaky gut. It doesn't. I don't even hear that anymore. So this was a little bit of a shock to me. Like my head kind of went back. Like, really? Really? There's people who looked it up and think that it doesn't exist. It's amazing to me that there are people out there that are even putting this stuff online, because the data is beyond mind-numbingly, it can't be overstated how overwhelming it is. Oh, and by the way, we use it in our practice all the time. In case you have not watched this before and you wanted to watch the 120 hours that we put on, you'll get sick of hearing us about leaky gut and gut problems and how they are leading to immune issues, and how the data is now starting to cascade out on the immune issues and the gut. And the only way that happens, people, is if you have a leaky gut, right?
Right.
I'm beside myself. I just got this like a couple of minutes before. So if I'm like, I haven't gotten into my past this, so you're getting it instead of me calming down before we do this.
And the natural evolution of things is such that.
Oh, and all those hours that we did, there's more attached.
Exactly.
To all those hours that we talked about the gut, there's even more data attached than we have sitting here. So
there is. And so going back to the natural evolution of things, within alternative medicine, there's sometimes, there are factions within alternative medicine and mainstream medicine that will feud. And when you have the burgeoning concept of leaky gut syndrome, and it's a poorly used term. It's not a good term, as you said.
I don't like it. It sounds
the term
demeaning or so.
It does, yeah, it does. But now you have leaky gut syndrome coming out 10 years ago, 5 years ago, clinicians are starting to use it. At that point, probably a lot of mainstream medical people or those who don't like alternative medicine are going to say, oh, well, this is going to come and go. It's just like any other fad. Well, then the problem is that this leaky gut phenomena has not come and gone. It's just continued to explode, and more information is coming out on it all the time. So now, as a consequence of that, there are some groups within mainstream medicine, just like there are some groups in alternative medicine, they're going to feud about this, they're going to war over this, and they're going to write incredibly derogatory statements about this whole condition. It's going to create a lot of confusion for patients who are being treated for this leaky gut syndrome, and it creates a lot of ambiguity. So that's why we're doing this, and that's why it's reared its ugly head again. And so we kind of feel like we need to make a statement about this.
Gut is like where it's at now in research. Didn't they say MS was leaky gut?
Oh, there's been
related to
associations.
MS is related to leaky gut and MS. In the literature, that's not us saying that. That's the literature that came out. That, by the way, coincides with what we have seen clinically here in the office for at least the past 7 years, if not more. So, I mean, it's
right. Well, and so
like crazy.
The way they attack it, so they'll say, oh, it's a hypothesis.
Right.
You have to keep in mind within medicine, if they're going to use a drug, for example, they're going to say, okay, we have a drug. We think this drug may work. So we're going to do a pilot study, and then we're going to do a bigger pilot study, and then we're going to do an RCT, and then we need 3, RCT stands for randomized clinical control trial. And so we're going to do 3 more of those, and then
we have to have a paper published.
Oh, huge, tons of papers. And then you get the FDA involved. And then ultimately, after 17 years on average, if that drug was able to uphold that scrutiny, then it can be used on the market, and they can make, big money on it, because that's the model of it. We're not knocking that. That's just what it is. So when you have people saying, oh, it's a hypothesis, it's unrecognized, there's lack of credible evidence, that's the aim at which they're taking it, because we don't have 17 years of a randomized clinical control trial showing leaky gut is the one and only cause of this condition. That's what they're trying to say. Whereas when they say that, they may not actually say it, but that's how they're saying it. And then it creates confusion in you thinking, well, leaky gut syndrome totally doesn't exist. And is my alternative medical practitioner or my alternative doctor, is he lying to me? And that is not true either, because there's tons of research associating leaky gut syndrome with a number of conditions. And you also have to realize that this literature is pretty much in the last 5 years primarily, definitely the last 10 years for the most part. So it is a new entity. So you have to keep that in mind as well. But
so that entity is not getting into the clinical doctor's hands.
No, not yet.
Because during that 17 years, it's not getting into their hands. So so the rest of the world knows it's probably there, but it's not going to get into their hands until it's run the gauntlet. So your doctor's going to sit there and say, oh, I don't know anything about it, or I don't.
Yeah.
It's what did one doctor say? It's baloney. It's a theory. It doesn't exist, or those types of things. But that 17-year gauntlet, you got to understand, nothing happens in the medical doctor's office. Today, in Hashimoto's thyroiditis, which is a whole separate subject, the Mayo Clinic for the last 6 years keeps putting out communiques saying, we don't know what to do with this. We need a randomized controlled study. So your endocrinologist doesn't really know what to do with Hashimoto's, even though there's this much data on it, because of that 17-year lag. Okay. And it's sitting there, and people are getting better from Hashimoto's by using alternatives. We work with medical doctors on the Hashimoto's, and yet your average endocrinologist has no clue what to do with it. Mayo Clinic, by their own admission, they call it subclinical hypothyroid. You can look it up. For those of you who want to look it up, they'll say, we don't know what to do with it. Same thing is happening here.
Exactly.
Same thing is happening here.
So then you go and you talk to your doctor and they don't know about it. So they're going to say, oh, it doesn't exist because they didn't learn about it in med school, or they haven't learned about it at a continuing education course. Meanwhile, for those of us that stay up on the newest of the newest literature, because that's how we get patients better, the data is there. I mean, it's glaringly obvious. So I think we should get into it.
Yeah, absolutely.
So there are a number of conditions we put together today within these 112 references. And I'll start with type 1 diabetes. And I'll just start with a quote. And this, I'm going to be a little pedantic today. I'm not horribly pedantic. Pedantic means, like trying to reference everything you say. But I'm just going to do it at a few points so that you can really see everything we're saying is coming from credible literature.
Yeah, and then they can go back to.
You can go back and you can read
and look at the references if they want.
So if you go down to the bottom of the page where we have all the references attached, it's called a clipboard. You'll see in clipboard article number 1, it's from the Journal of Pediatric Diabetes in 2015. And they said there's increasing evidence, both functionally and morphologically, supporting that, excuse me, if I can read my own writing. Excuse me.
So none of us can read it, so we don't expect you to be able to read it.
Okay, here we go. Increasing evidence, both functionally and morphologically, supporting the concept of increased intestinal permeability as an intrinsic characteristic of type 1 diabetes. So does that sound hypothetical? Does that sound like a theory?
Sounds like it needs to be explained.
Okay, so I'll explain it. I'll read it again. There's increasing
but no, not to me. It does not sound like a theory.
Both functionally, from a functional and morphologically, supporting the concept of increased intestinal permeability as an intrinsic characteristic of type 1 diabetes.
Intestinal permeability is leaky gut.
And that's another thing that's going to confuse you, because even if you do know how to do some research and you go into PubMed and you type in leaky gut, you're not going to get a ton of articles. You have to type in intestinal permeability, you have to type in intestinal hyperpermeability, you have to type in intestinal mucosal barrier integrity. Right. You have to know all these different terms for this problem. You have to type in subclinical endotoxemia, and we'll get into that. What this means with type 1 diabetes, what they're finding, type 1 diabetes is an autoimmune condition where the immune system will basically kill the pancreas, typically in young individuals. It can happen later on in life, past the age of 30, but typically it's young individuals. The immune system kills the pancreas can't make insulin, so then that person has to start taking insulin. What we're seeing with type 1 diabetes is that leaky gut is there. It allows food antigens, bacterial antigens to get into the bloodstream. The immune system attacks those antigens, like your food molecules. And if those immune cells to the food molecules look like your pancreas, then guess what? Your pancreas is getting attacked.
This is how you develop food sensitivities. There is no way to develop a food sensitivity unless the antigen, the undigested food particle, which should be in the toilet, goes through your intestinal barrier and into your bloodstream. The only way it gets through there is if there is an intestinal barrier breach. You know that as leaky gut.
Exactly. Moving on to rheumatoid arthritis. Big one. Rheumatoid arthritis, we now know that they found the specific immune reaction that occurs in RA, where the immune system kills the joints, like in the hands, happens when bacterial DNA gets into the joints from the gut. So they found bacterial DNA from your gut in the joints of RA patients, and it causes this specific immune reaction for rheumatoid arthritis. They've also found another bacteria from the gut that gets into the urinary tract. How would it get there? Typically, it's going to get there. They're feeling from passage through the intestines into the bloodstream. It goes into the urinary tract. Proteus mirabilis is its name. And they have found that the gut flora, so basically your bacteria in your intestines, can change if you go on a vegetarian diet with rheumatoid arthritis, with this Proteus mirabilis. So there's absolutely a gut connection between RA and leaky gut syndrome.
Is there another vehicle for anything to get out of the gut and into the bloodstream to cause all of these things? No.
One argument they can make with the Proteus mirabilis is, somehow you're getting it from your butt into your urinary tract. That's a whole nother discussion.
Or sinus, sinus?
Well, there's a mouth bacteria too, Porphyromonas gingivalis, that has been shown to do the same thing.
Okay, but it's the gut.
It's the gut.
And how do we know that? Because we've seen people go on, for those of you who are patients who've asked about this, we've seen people just go on the initial diet in which we pretty much just take everything out of there that we've seen an immune patient and or neurological patient respond to, and we've seen the rheumatoid arthritis improve dramatically. You're going to talk about MS?
Yeah, we're going to go down.
Or we saw an MS patient literally within 2 weeks, unable to get out of a chair, come in walking in on crutches. No, we're not miracle workers, just let you know that. There are people that we failed on and things of that nature. We're not someone who said, oh my God, all the MS patients, you should come here for this. But you should all try putting yourself on an allergy elimination diet, because it calmed down the antigens, it calmed down the inflammation, but the antigens and the inflammation had to get through a leaky gut to get somewhere to damage the outside linings of their nerves, so that their MS was reacting. And he'll cover that. I'm beside myself. I can't believe that we're having to explain this. It's like crazy.
And technically, we're not telling you to go on any specific diets if you're not our patient, but you're making
that's
a
right.
point.
He doesn't want you to get sued if you're going on an allergy elimination diet and find out what your allergies are. I get it.
Yeah, I'm just protecting you.
I know.
Exactly.
I know.
I'm always looking.
We have a lot of crazy people out there.
There are.
Not our watchers, not our listeners.
No.
But
so we covered rheumatoid arthritis. I mean, it's pretty much a slam dunk between this Porphyromonas gingivalis from the mouth, Prevotella species from the gut, Proteus mirabilis from the gut to the urinary tract. The studies on Proteus mirabilis, it's been documented in 6 different continents. It has been documented that a urinary bacteria is causing a major cause of rheumatoid arthritis, yet you're not hearing anything about it. In fact, most rheumatologists haven't heard anything about it. And we just recently had a rheumatologist, after a patient was able to get off all their meds, say, wow, I think there really is something to this gut connection.
Right.
But they're not taught that, because they're taught we got to give methotrexate, we got to give Humira. It's just a model, people. You got to understand the playing field. So now let's go to other problems in the gut. So inflammatory bowel disease, Crohn's disease, ulcerative colitis. These are autoimmune conditions to the gut. Go ahead and read the research articles we have on inflammatory bowel disease attached. It is all throughout that literature that basically Crohn's disease is secondary to different microbial infections in the gut, where the microbes, whether it be a type of yeast or whether it be Klebsiella, which is a type of bacteria, is getting through the intestines due to leaky gut, immune system attacking those bacteria, creating the Crohn's disease process. They get a gazillion food intolerances because their gut is so permeable. And gastroenterologists don't know what diet to put you on because you have so many food intolerances.
And remember, the inside of your intestines is 1 cell thick.
Mm-hmm.
Every time I say that, it's hard for me to even say that, because it's hard to imagine that there are so many things in that 1 cell thickness.
Mm-hmm.
You know, there are enzymes that break that there are enzymes that break down your casein. So you have milk intolerances. A lot of your immune system resides in that particular area. There are brush border ends. There's all kinds of stuff in that 1 little cell. How hard could it be with inflammation or with immune responses or I said inflammation, or any of these types of things, to break down that 1 cell? Not very. I could almost write a paper and make an argument that everybody has a leaky gut. Seriously, you could. I haven't done that, but I know people have proposed that, and you would think, how could you not? People come in here. I mean, if I put my hand on, if I do my part of the exam and I put my hand on here, and you have tenderness in this area where your distal ileum, that's part of your small intestines, hooks into your ileocecal valve, which is a valve between there and your large intestines. If you're tender in that area, I'm going to tell you right now, you got a leaky gut, because we will do that Cyrex 2 lab and it will correlate every single time. We should talk about the sensitivity and specificity of that lab, if you know what it is, but I think it's pretty high.
It's pretty high. I don't know the exact numbers, but I know it's high. I know it's the best test in the market, and we can talk about that. So with Crohn's disease, ulcerative colitis, one of the articles we attached said, chronically dysregulated homeostasis of the epithelium is occurring in these patients. So if you're not a clinician, you may not know what that means. That means that basically they have leaky gut syndrome. That is what that article is saying. But if you just search leaky gut, you're not going to be able to find that. So that's why we attached all this. Moving on to autoimmune hepatitis, tremendous associations. Autoimmune hepatitis is an autoimmune condition that attacks the liver. We've had patients with autoimmune hepatitis. It has now been shown that we have an article saying they have leaky gut syndrome, bar none, as the cause of it, or a major cause of it. We have hepatic encephalopathy. So that's where you get basically a liver disease and then it affects your brain. And we have an article saying that lipopolysaccharide causes it. So lipopolysaccharide, for those of you who don't know, are pieces of bacteria floating from your intestines at too high of a rate. Well, lipopolysaccharide are the pieces of bacteria. When they float at too high of a rate from your intestines into your liver, because all the blood flow from your gut goes to your liver, that's called subclinical endotoxemia, and it can poison your liver, and then as a result, that can poison your brain. Ankylosing spondylitis. So for those of you who hear the commercial every morning on Pandora, like I do, if you wake up with a stiff back and you're a 35-year-old male, then you should be thinking, well, do I have ankylosing spondylitis? It's a condition where basically your spine will fuse. It's an awful condition. It can be incredibly disabling, but they have now associated the same thing with Crohn's disease, basically, where the Klebsiella bacteria gets through the intestines. They see that in ankylosing spondylitis.
All autoimmune problems.
All autoimmune problems.
75, 70, 80% of your immune system is where?
In your gut.
For those of you who watch probiotic commercials, you should know the answer to that. It's in your gut.
Let's move on to obesity. So what do you think about this, everybody? Number 70, gut microbiota as a key player in triggering obesity, systemic inflammation, and insulin resistance. Sounds like a hypothesis, doesn't it? Just so you know, in the scientific literature, they don't make statements like that. Gut microbiota as a key player in triggering obesity, systemic inflammation, and insulin resistance.
And you can't lose weight. We're looking at it undiagnosed or poorly managed thyroid. We're looking at blood sugar, which, by the way, could be the gut screwing up your blood sugar, like Dr. Gates talked about before. We're looking at stress hormones, and we're looking at the gut again.
There you go. There's a great article, 81. I recommend all of you read it. Metabolic endotoxemia isn't more than just a gut feeling. Here they're talking about it in a cardiovascular cholesterol journal, saying that this is the cause of obesity. 2/3 of the population has a problem with weight. So this is kind of a big deal. So that's why we're saying leaky gut really pertains to everyone, because 2/3 of the population has a weight problem or is obese. And then we have these autoimmune diseases, which are so prevalent. 1 out of 6 Americans, at least 1 out of 3 females have Hashimoto's thyroiditis. It just goes on and on. Can I find article 107? Here we go.
Go ahead.
Circulating zonulin. So zonulin is a protein that binds, zonulin is a protein that will basically cause leaky gut syndrome. It poisons the occludin-claudin zonulin complex. So circulating zonulin as...
It damages that little one cell thing so things can get through.
There you go. Thank you. That was better. Circulating zonulin, reference 107, a marker of intestinal permeability, is increased in association with obesity-associated insulin resistance. So it's there. It's there. I mean, what more do you want? The data is there. So,
you know, yesterday there was an article. Maybe you're aware that now chronic pain. I personally have been involved in trying to understand chronic pain since 1987. Okay, and it's always been really. I've never been aware that it was huge. It was big, much bigger than anybody really thought, and it's been growing exponentially. Oh my God, over the last 10 years. And yesterday, or it comes out, some government agency said 59%, you've heard us say 130 million now they said 59% of the American population has chronic pain. And their solution is we need more bike paths. We need more green belts so that people can walk and bike. Certainly, it was something about diabetes. They seem to be really, really on diabetes. Except a lot of the people who come in here who have diabetes can't get their numbers down. A lot of the people who come in here with diabetes are on 2 and 3 medications and can't get their numbers down. They can bike and they can walk and they can eat right and they can do everything and they can't get their numbers down. The reason is in those papers. There are bacteria there that alter their insulin, and the reason that it's able to do that is leaky gut. Yeah. And I will tell you, they're not looking in the right direction, because the vast majority of those 59% are either going to have post-traumatic stress syndrome, they're going to have an autoimmune problem, they're going to have a leaky gut that's letting all of this stuff get out of there. The literature is saying that, but guess what? Remember the 17 years? Mm-hmm. It's going to, from these very definitive studies, it's going to take a long time in the medical community to get that way. And the big part of it is because that 17 years has developed a drug for it.
You got it. That's what they're looking for.
And so here's the other thing. In the alternative field, we don't have that problem because you don't need drugs to heal the intestinal permeability. But here's the deal, okay? In the alternative field, you need to, if that person has a stress mechanism going on, if they do have that brain that's going fight flight syndrome a million miles an hour, all day long, that is flooding the inside of their gut with cortisol, which, by the way, has been shown to break down that one cell barrier and cause leaky gut.
Okay. Reference number 13.
Reference number 13. Now you have the people out there trying to heal their leaky gut with herbs and botanicals, and it's not working, and it's because of that. Exactly. So you have to calm that down first. Now you have to find out what's in the gut. Now you find out what's in the gut, and you have to find, do you have H. pylori? Do you have parasites? Do you have bacteria? What do you have in there? Then you have to fix that. Most of the time you can do that without drugs. Sometimes you might need an antibiotic or a parasitic cleanser or drug or along those lines. Most times you can do that without drugs. I'm making a point here. And then you can heal the leaky gut with herbs and botanicals and diet and stuff like that. Now, for the most part, you don't need drugs to do that. The entire direction, unfortunately, of the data that is overwhelmingly there on intestinal permeability, okay, better known today as leaky gut, is pointed towards the drugs. And people have complained because it takes forever and it costs billions of dollars to get drugs on the market. That is the lag period that you are seeing here. And I don't know if this sounds like a bunch of alternative guys who are just saying pixie dust or oh, there's leaky guts. But for those of you who are under care here, and you believe that you have the ability to go and do this type of background research, or haven't done it, or have somebody who thinks that they are and has done it, they have possibly not had the clinical experience with doing this and seeing it being a major player in getting people out of chronic pain. That's a good point. Okay. And if you are one of the patients here that said something about that, I'm going to tell you right now, you were just placing landmines in the path of your recovery. If you were going to embrace some probably not credible resource, and we should address that, the credibility of resources out there who are saying that there's no leaky gut, because there are non-credible resources like Wikipedia, okay, saying that it's like Wikipedia. For those of you who think Wikipedia is like Encyclopedia Britannica and there's people reviewing the data in there and so on and so forth, there's not, okay? There's not.
For example, on leaky gut, if you read some of the articles on leaky gut and the references they will cite, they cite a website that goes after alternative medicine practitioners. That's who they cite. So are they citing, do they have 112 references gathered basically in 4 hours last night? No, they're not.
They don't have
I think they have about 9 references. And, that can start a war. They can go to whatever length to create their argument. But the argument's here. All you got to do is read these research articles. Just read the title. I mean, here, traumatic brain injury. So going back, he said stress, reference 13. Break down the barriers, the gut microbiome, intestinal permeability, and stress-related psychiatric disorders. All about the gut. Traumatic brain injury. All our guys coming back from the Middle East. These football players, soccer players headbutting the ball, rugby players, boxers, ultimate fighters. We just had a death of an ultimate fighter in England because of a brain injury, to my knowledge. So basically, the brain injuries, and here's a reference, impaired intestinal mucosal barrier function is common traumatic brain injury. Go to reference number 14. Labetalol. Labetalol is a drug used to block stress hormones, because one of the first things you see in a traumatic brain injury is that stress hormones go up and the gut breaks down. So you get a leaky gut, which creates inflammation that then goes back up into the brain. Because your blood-brain barrier is now leaky because you slammed your head against something. Now all this inflammation from the gut triggers the immune system. It can go into the brain. And now we have the process of what is now being referred to as chronic traumatic encephalopathy that they're now seeing and can only diagnose after you die. But all these guys who have been playing these sports and they can't talk, they talk like they're drunk, they can't find their way around town, they're getting lost, they're losing their tempers. This is what it is. It's right there.
And
That's
for
right
those
there.
of you who watched and are sick of me hearing me say this, I've got all of this.
Right? Yeah, exactly.
I've had 9
Case in
concussions.
point.
I have leaky gut. I have to. And I'll tell you another thing. Now, what's the data on leaky blood-brain barrier?
I didn't even attach that.
Okay.
But
So if you have a leaky gut, you have bad blood-brain barrier, and you have low hypoglycemia, you should not drink because you are going to become an alcoholic. I will tell you right now, because it gets through there, it gets through here, it alters function, it alters glucose, it starts bringing a lot of damage to your brain. You are the cheap drunk. Okay. Yeah. Well, it's true. It's true. This stuff is all out there. The days of these quack busters who are online, who just have some axe to grind when they don't know their butts from a hole in the ground when it comes to this stuff, should be over. The data out here is so overwhelming, but you're overwhelmed. You're going through a serious process. You don't have the time to go through. Frankly, there's a good chance you may not have the background either scientifically, you may not have had years and years in working in labs. Maybe you haven't seen dozens of patients. I get that, okay? But we have, and we've done it. Can they see that? Can they see all these papers here? Can you see that? Each one of those, almost each one of those, every 2 or 3 lines,
double-sided too.
Double-sided is a study. And I have a little difficulty reading after 9 concussions, so it takes me days to read all of that stuff. And I understand the lingo. Okay, so I'm not expecting people to go out there and read all that, but you should not take one study and say, I read a study that said there's no such thing as leaky gut. Or one of the big things in research today that we've had to start to really assess on every research paper is the integrity or the intention of the researcher.
That's good.
Okay, it's huge.
That's good.
It's huge. There's so much garbage research out there because the person who's going to benefit from that research might have funded the research. If you're reading research from some quackbuster, you need to read up on the quackbuster and find out what their backgrounds are as to their credibility or what their abilities are to take this type of data and to actually evaluate it properly and understand whether they've ever seen it put into practice or anything like that. That's really another thing. It's very important because I'm still, as you can tell, I'm still blown away that we're even talking about this. I mean, this is what we do every day. This is like the core. This is like one of the 4 big cores of what we've been able to understand to come up with consistently successful results in these types of situations. And the testing is pretty good on this.
Well, the testing is building. That's what we'll say. The testing is building. It's
building.
We have our opinion on the best test in the market, but it's building.
Not all testing is good on this.
Exactly.
Okay. So I shouldn't be, but we use a test from Cyrex Labs, and it's not
we don't get any kickbacks.
We don't get any kickbacks to say that or anything. We have just found that What is the test we run all the time?
Cyrus array 2.
Cyrus array 2 on
on every patient.
On every patient who walks in here. And our protocols are very individually patient oriented. But to all of those who as hard as it was for my mentor, Dr. Karazian, to beat into my head for 2 years that so many people who had chronic pain problems, particularly fibromyalgia and stuff, had Hashimoto's, okay? It was kind of a challenge to come to the grips that almost everybody who came in here with some sort of a chronic issue, neurological issue, because these entities that get out of the gut, celiac, okay? Celiac is where you develop an autoimmune attack to the gluten molecule in your gut. But now they know that somehow that exports entities outside of the gut to the brain and to the nervous system. 70% of the time that you have celiac, and the other 30% of the time you have the gut problem. How does it get there? It gets there by a leaky gut.
Right.
I mean,
it's called the extraintestinal manifestations of gluten. Watch our broadcasts on gluten intolerant
Yeah.
neuropathy, or just when we talk about small fiber neuropathy. I mean, it's all through it. Gluten ataxia. Dr. Hajivasulu from the United Kingdom, well-renowned neurologist. He's the one who blew the door open on that. Let's go through a few more. Multiple sclerosis, as you said. Everybody look at reference number 17. Intestinal barrier dysfunction develops at the onset of experimental autoimmune encephalomyelitis. That's experimental MS that they use in mice. And can be induced by adoptive transfer of autoreactive T cells. What happens here, they have MS in a mouse, they take the immune cells out of that mouse, they put it into another mouse. Within 7 days, they see the gut breaks down first. 14 days, the blood-brain barrier breaks down. Then the animal gets MS. Okay, so I think that pretty well says that. Depression, reference number 29, altered fecal microbiota composition in patients with major depressive disorder. This is raising this new question of psychobiotics. So we see the bacteria in patients who are depressed are different than the bacteria in people who are not depressed. And they're seeing that the bacterial end products, so bacterial poop, if you want to think of it that way, that those bacterial end products can actually get to our brains and negatively affect our brains. And so the theory right now for this is, can we use probiotics to basically reculture the gut to produce better end products so that the brain functions better? So that's early in its research, but we have the foundation there that there's stuff going on in the gut of patients who have depression. So we have that piece. Parkinson's, reference number 84. Where's reference number 84? Structural alterations of the intestinal epithelial barrier and Parkinson's disease. So we see with Parkinson's patients, frequently they get small intestinal bacterial overgrowth. Everything with Parkinson's patients generally slows down. They can't move their face as much. They can't walk as fast. But we're also seeing that same disease process affects the gut. Motility slows down. They get too many bacteria. The gut breaks down. Pieces of bacteria get into the bloodstream. And that's thought to create excessive inflammation and possibly maybe part of the disease pathogenesis of Parkinson's.
I mean, you can name everything that walks in the door here.
Pretty much. We have type 2 diabetes. I mean, type 2 diabetes is a slam dunk. That's one of the earliest ones that was really being discussed. We have reference number 78. Sorry, hang with me. Leaky gut and diabetes mellitus. What is the link? That's reference number 78. Read that one.
So you can't lose weight. You come in, we're looking at thyroid, blood sugar, adrenals, gut. You say, oh, I've got diabetes type 2, and I look at you, and you're thin, and you're working out, and you're eating like a vegetarian, and you're eating great, and yet you got diabetes type 2, and it's, well, you're not thin, okay, if you weren't losing weight.
Right.
All right, let's say you come in, and you have another entity. Let's say you have fatigue, but you're actually thin, and you have diabetes type 2, and you're actually eating well, and you're exercising, and you're wondering, why is this blood sugar like not going down? This blood sugar is probably not going down because you have a bad gut. Entities are getting out of the bad gut. It's altering your insulin's ability to work. And even though you're doing everything right, you have diabetes type 2. Your drugs aren't working. You get your gut fixed. The drugs go away. The type 2 goes away, and maybe your fatigue goes away, or your depression goes away,
Exactly.
or whatever.
Here we go. Reference number 101. Increased circulatory levels of LPS. So that's the bacterial components we talked about of these gram-negative bacteria. They break off like dandelion flowers blown in the bloodstream. and zonulin. So that's the breakdown product of the zipper mechanism that keeps your intestines together. Signify novel biomarkers of pro-inflammation in patients with type 2 diabetes. So that's a great reference. And actually this reference 101 was the first one to solidify the diagnosis of leaky gut as it pertains to leaky gut. It was really the first one. It's the landmark study where they really showed leaky gut does exist in type 2 diabetes and seems to be a driving cause of type 2 diabetes. It was 2014 that came out. Reference number 104, the intricate association between gut microbiota and the development of type 1, 2, and 3 diabetes. So type 1 is where you have to take insulin and you're a young kid. Type 2 is where you develop it typically later in life. Sometimes you have to take insulin if it gets really severe. Type 3 is prediabetes that's associated with Alzheimer's disease. And it all traces back to the gastrointestinal tract. Irritable bowel syndrome. So before Dr. Rutherford was talking about, drugs and how long it takes to get approved. Well, now there's a drug for irritable bowel syndrome that actually one of the main things it does is it heals up leaky gut syndrome. It's called rifaximin or Xifaxan. You may see the advertisements if you have IBS type D, which is diarrhea, and you have bloating and pain, but you have diarrhea, take rifaximin because it's going to help your symptoms. Well, rifaximin is a medical grade antibiotic, but it heals leaky gut.
And if you're out there going, well, I took it and it didn't heal my leaky gut, it's because you have this overfiring sympathetic nervous system that's sabotaging it. You might have other things in your gut that weren't being taken care of. So that's healing your leaky gut while these things are continually perpetuating it. So,
and then when you read controversial statements about leaky gut, people are saying it's a bunch of hooey, and they'll talk about there's no association to autism. Well, if you want
to read that the other day.
If you want to read that, then read reference number 72. Pathophysiology of autism spectrum disorders, revisiting gastrointestinal involvement and immune imbalance. This is from the World Journal of Gastroenterology. In this article, they would go on to say that one of the major pediatric associations in America is basically ignoring all this information relative to the gut and autism. And they're saying we as gastroenterologists need to pay more attention because the data is there, the evidence is there, that there are food intolerances associated with autism. Leaky gut appears to be a major player, and we need to start doing something about this. That was the impetus of that article.
Who was the actor the other day? Robert
De Niro.
Robert De Niro.
Oh boy, let's not go with that.
Well, no, but in the end, he was trying to bring things to light.
No, there's a whole backstory that you and I haven't even talked about on that.
Okay.
Yeah.
And the question was, but they said,
okay,
they said that this was been put to rest. What you just got done saying was not put to rest in the literature. They said it was put to rest, and they shamed the poor guy into shutting his mouth and making almost apologizing.
De Niro.
Yeah.
Right.
Yeah, absolutely.
Right.
So and we're not here to get into that thing.
Right.
Okay.
Right.
We're not. Okay. There's so much out there on vaccinations and flu vaccinations and all. And there are explanations for that, which are probably a little bit more sane than what's being put out there, both sides. Okay. But there's just a lot of stuff going on there. That's not our world. That's not what we want to do. We just want to help the people coming in here. Person comes in here and they think that leaky gut doesn't exist, and they're going to argue with us about it. They shouldn't even be here because it is going to, they're going to do things that are going to sabotage what we're doing. It is a humongous part, not only of people getting better in most chronic diseases. And as you're hearing, they're probably going to find almost every autoimmune problem coming from there. 75% of your immune system is in your gut. Okay. We're stressed out of our minds, and stress hormones are damaging our guts 24 hours a day. It's our closest relationship with the world. We eat, it goes in our mouth, it gets broken down, it goes in your gut. Oh, and it gets absorbed, not through the leaky parts, but through the proper parts. It gets absorbed and it literally becomes part of you. How more commonsensical could it be that would be a ginormous part of what's making people ill? I think it was somebody who had as little credibility as Hippocrates, who said in 500 BC, look to the gut for all causes of human disease. So it's like it's so logical that this is what was going on. We ultimately, when we came to one day I was talking to Dr. Gates, and we were looking for different paradigms and we had a paradigm, but we're looking for an order in which to treat people so that they would get better quicker, so that we would have tools to help them to stay better longer. And I said, when do you see our patients get better? Because we were doing it like almost at the end, right?
Mm-hmm.
We're doing all this other stuff and we were doing it at the end. I said, when do you see our patients make quantum leaps? And he just looked at me and said, when we do the gut. We said, okay, let's do it first. And it made an enormous difference in how rapidly patients got better. And then in healing the gut first, there were a number of things we were treating that we ultimately ended up not having to treat. So we don't know everything that's in the gut yet.
Right.
There are 4 pounds of bacteria in there. It's probably going to take them a century to go through all of those.
We have more bacteria in our intestines than we do cells in our body. That's how complicated it is. So yeah, we're learning right now.
And all we know is that once we get that gut under control, lots and lots and lots of things get better. Joint pains get better. Depression, not in everybody. And in the ones that it doesn't get better, it means there's something left that needs to be addressed. But you name a symptom, you can almost virtually name any symptom that there is. And we have seen it disappear in certain cases after we got through the initial month or 2 or 3 of getting that gut under control.
Mm-hmm.
Yeah,
we're not saying we cure everybody. We properly select our patients,
all.
but we've seen phenomenal transformations by handling the gut and the brain.
Some of this I'm saying for the couple of patients who requested this, and others I'm saying for people who are just looking in.
Yeah, and so when we look at this entity as a whole, we look at obesity, again, 2/3 of the population. We're looking at autoimmune disease across the board. And 1 out of 3 females now have Hashimoto's. 1 out of 6 individuals have autoimmune disease. We have depression, which is about 16% of the population. I didn't even tie anxiety in today's broadcast, but depression, anxiety, this gut connection is being talked about. Anxiety is as high as 30% of the population. We have all these traumatic brain injuries. We didn't even really get into gluten. I attached some articles there, just some, not all that I could have. Fibromyalgia, that's a big problem. Polycystic ovarian syndrome that ties in with the gut because of insulin resistance. That's upwards of 20% of females who have trouble with their menses every month. They have trouble getting pregnant. They have trouble losing weight. That's why we say, and that's why we're so adamant based on the literature and our clinical experience, that this leaky gut problem is something that should be paid attention to. So I think we'll conclude on that.
Is leaky gut real?
Leaky gut is real.
Leaky gut is real.
Yeah. So thanks for watching. And for more information, go to powerhealthtalk.com, and we will see you next week.